because this is what works. And what works is majority of Americans saying losing mobility is their top aging concern. Now, our mission statement is to keep you strong, mobile, and independent for the rest of your life. And that's what we're aimed at doing. And Balance University is different because we include 4 pillars. So some of these other programs out there, they'll include 3. They'll leave out flexibility or they'll leave out posture. We don't do that here. So according to the American Physical Therapy Association, they recently did a study. This was done between May 1st and May 14th of 2025. They conducted a national survey of about 1,200 respondents. And what they were looking for was mobility questions. Are you fearful of losing your mobility? We all know leg strength is gold. Without leg strength, you lose mobility, right? And so the American Physical Therapy Association has launched PT Future Me, PT for Future Me. It's an education campaign aimed at encouraging people of every age and ability to see physical therapy not just as a treatment for injury, but as a lifelong strategy to move better, age stronger, live fully, live longer. That's what we're doing in here. That's exactly why you guys get up and you come into here, into Balance University. I give you homework. You take that homework home and you do it. This is where you say, yes, we do it. And just for reference, I want you to know your insurance, you get an allotment every year for physical therapy, okay? And what they're trying to say is, hey, look, it's not just for injury or post-recovery from surgery or an operation. It's about $1,300 per calendar year, okay? Check with your provider. I'll be completely honest, I haven't looked at that number for a couple of years, and we know things change all the time, so double check. But if you guys are already paying for it, take advantage. If they're going to offer you preventative treatment, and it's great to see us starting to move in that direction because we have been a society that waits for something to happen, then we treat it. Versus the East, they tend to treat prior to the symptoms. And that's what we want to do here. We're avoiding unintended falls. This is a fitness class targeted at your balance. Now, here's the results really quickly, and then we're going to get started. National survey, it uncovered a striking insight, and you guys may be able to relate. I know we don't have anyone here over the age of 65, but you could imagine 66% of respondents say their biggest fear about aging is losing the ability to do the things they love. And I think that's a lot of us. A lot of us can fit in that category. So let me close by saying this, and this is a quote here by the president of the American Physical Therapy Association. Many people know what physical therapy is in terms of rehabilitation, but not as many understand its value to prevent injury, support lifelong mobility, and improve overall health for people of all ages and abilities. So they're trying to make that turn. They're trying to get that paradigm shift into our society. And if there's anything that we can do as a public, we need to do that. 2016, $50 billion were attributed to fall-related injuries. Medicare and Medicaid bore 2/3 of those costs. 10,000 Americans turn 65 every day. Think about my generation. There is not enough of us. When Social Security started, there were, 149 workers to pay for every retiree. We're down to 7. And I can go off on a tangent there. I'm not. But what I'm saying is I'm trying to do my part to keep you guys healthy and keep those costs down. I know you guys want to do that too. The most recent number that I found was from 2020 and 2023, and those numbers are now $80 billion to $100 billion attributed to fall-related injuries in our senior community. Medicare and Medicaid still covering 2/3 of those costs. So we're doing this, right? We need to do this. And that doesn't mean you guys leave. We want you here, right? We just want to make sure that you're strong, mobile, and independent for the rest of your life. And one way we can do that is by taking some assessments and checking your balance. How about that?
All right.
All right, let's stand. Let's go behind our chair.